So I'm Darius. I'm, as Annie mentioned, principal consultant at STL, and I actually wear a couple of hats. So one is I lead our work, our research and consulting into digital health, but another is I actually also lead our work and consulting into private networks. So this panel, which will dive into the role of 5G within healthcare, is a really great intersection. So I'm really interested to hear kind of what the panelists have to say, and to obviously hear your questions as well, and be able to put those to the panel. So what we're hoping to cover off today will be a little bit about the realistic 5G applications and the benefits that we're seeing. Of course, over the past couple of years, we've been talking a lot about the possible role of private 5G or 5G on the public side, and now we're starting to see more tangible use cases and realistic applications. So diving into that side of things, we'll talk a little bit about the challenges in healthcare, I guess, the challenges that connected technology is addressing, but also the challenges to adopting connected technologies. And then finish off with a little bit about the kind of partners in the space, the ecosystem players, what is the role of the telecoms operator versus new entrants in the market versus, even the hyperscalers, as Leo mentioned in the previous presentation. So hopefully, we'll be able to cover off quite a lot of interesting topics. If you do have any questions, there is that question function, so do drop them in. Either we'll be able to get to them as we go, or make sure we leave enough time at the end to answer any of those. So with that, we can do some introductions of the panel, and I'll actually hand over to them to run through a quick introduction to themselves. So first on my screen is Sandeep. I don't know if you wanted to go first.
Hi all, really nice to meet you all. It's Sandeep Raithatha. I work at Virgin Media O2, which is a joint venture which we've recently formed with Virgin Media and O2, bringing best of fixed and mobile. And I lead on strategy, innovation, and 5G IoT within the B2B domain. So I'll be happily here to talk about some of the experiences we have with 5G and healthcare.
Perfect. And I've got Joann.
Hi, Darius. Hi, everybody. My name is Joann O'Brien. I'm the Vice President of Digital Ecosystems at TM Forum. So I work with the operators and the suppliers on the strategy for diversification and growth beyond connectivity.
Perfect. Next, we've got Jayne.
Hey, everyone. So I'm Jayne Rooke. I work for WM5G. My background is health and care. I've spent about 18 or so years working in the health and care sector, and have now moved over to working with colleagues at WM5G, supporting health and care organisations on their connectivity and digital solutions.
And last but not least, we've got João.
Hello, all. Thank you. I'm the Director of Innovation and Strategy at Altice Labs. Altice Labs is the global headquarters for research and development for the Altice Group. And in my unit, digital health is part of what we do together of different digital solutions and innovation aspects of the strategy for the group.
Perfect. So as I said, we were going to start by looking into some of the realistic applications of 5G. And Jayne, I wanted to come to you first because you've got some kind of on the ground experience of trying to apply some of these connected technologies and the kind of benefits or the outcomes of them. So I wondered if we could start by hearing a little bit about your experience and some of the actual applications that you've been working with.
Yeah, so as I said, my background really is in health and care, so across the NHS and public sector. And I think everybody will be aware of, there's lots of investment at the moment in lots of things to do with digital technology, etc., to try and support health and care to deal with some of the problems and issues that they're seeing about waiting lists and actually getting people through the system quicker and actually joining things up, and also the ability to treat people in their own home rather than actually them having to physically go into a hospital environment. So some of the things that I've been working on with colleagues and that have been successful, some of them still in their infancy, but others are working well, are things like virtual wards or assisted living technology. So these are the types of things where if patients are or members of the public become unwell, there are ways of actually trying to keep people out of hospital by supporting them through solutions, which means that they can self-monitor in their own home, or are, if you like, home becomes an extension of the hospital. So instead of physically having to be in the hospital, they can have wearables or IoT solutions, for instance, in the home, that give indications, that give alerts if patients are starting to become unwell, so that they can be dealt with in the home to try and avoid a hospital admission. And the other alternative for that is, as people who have had a hospital stay, as they become medically stable, so actually don't physically need to be in a hospital building, but will still need a bit more monitoring, they can be discharged into home or a community more appropriate location with digital tech. So whether it's wearables, whether it's being monitored through a health and care team that are based in a central location but have regular contact and are able to see flags and alerts of things regarding that individual that highlight to them how they're doing. So sort of almost like a step up and step down facility. So some of the things that we've been working on are things like assisted living technology, virtual wards, things like connected ambulances, so that through satellite connectivity, actually, you can actually do some of the monitoring that's required outside the patient's home rather than convey them to the hospital to do that. And actually through virtual technology, you can actually, the consultant can actually view what's happening with the patient while they're in the ambulance, and you can almost have the conversation as if the consultant were in the ambulance with the patient. Other elements are things like prevention, so things like instead of having to physically go into a hospital setting, to have an endoscopy for things like early advanced warning of bowel cancer. Things can actually be delivered to a person's home, where they actually swallow a capsule that takes lots of photographs as it goes through the system. And through 5G connectivity, these pictures can actually be viewed by a consultant to identify actually whether there are areas of concern. And actually, through the technology as well, it actually guides the consultant to areas that look concerning, rather than having to watch lots and lots of images to actually get to understand whether they're there. So there's lots of things out there at the moment, lots of different innovative and creative companies that provide that, and lots of different ways for connectivity, from 5G to lots of others to actually support that.
And quickly, again, just back to yourself. You mentioned obviously the use of satellite, but obviously you're from West Midlands 5G, and you did mention 5G as part of the kind of capsule that may take those photos. What is the unique value, if there is a unique value in the move to 5G, or is there work and is there transformation that can happen on other forms of connectivity and for 4G on the roadmap to 5G?
Yes, I mean, so it's interesting. So I'm probably, of all of us on the panel, I'm probably the least techie person of all of us. But from my perspective, 5G is sort of about connecting anything and about user experience, where actually other types of connectivity are more about the consumers and connecting to other forms of technology. So I think there are some areas where 5G does definitely come into its own. But I think particularly across health and care, and it was interesting listening to your earlier presenter, listening to Leo, is some of it is that you almost can't, the NHS and local authorities don't have the luxury of ripping out everything that they've currently got. So some of it is building on what the infrastructure that they have is at the moment. So actually, if 5G is one of those solutions, that's great. But it may be that other solutions will actually help to deliver what they need to in the solutions they're looking to provide. So I think 5G is one of a number of solutions that would be helpful to support some of the challenges that we're seeing in this sector.
And Joann, if I'm not mistaken, you've been doing quite a bit of work on trying to understand that interplay and where can 5G play a role as part of that tapestry.
Yeah, so we've done some research on that with mobile telecommunications operators. So a number of operators around the globe are working in the health space. One at the connectivity layer, such as been described earlier, the end-to-end connectivity, mobile private networks inside the hospital, and supporting the rapid movement of patients, or efficient movement of patients back to the community, so that there's more efficiency around the acute services. However, some of the operators are also going beyond that and are actually moving up the value stack to deliver more of the health type applications. Often through mergers and acquisitions, they're actually building up their health offerings Examples off the top of my head would be TELUS and Telstra, Canada and Australia respectively, really making headways. Telstra being one of the biggest software operators in the health space. So there's two ways of looking at it. There's horizontally based on the 5G and the connectivity offerings, or there's vertically moving right up the stack into the health applications and offerings.
And Sandeep, obviously, as the telecoms operator on the call, do you see TELUS, Telstra, possibly Swisscom as benchmarks that you're aiming towards, or do you see them as painting a way for your strategy, or are you thinking about this in a slightly different approach and trying to capture maybe more of a horizontal platform play rather than moving fully vertically up the stack to the solutions provider?
Yeah, so I think all those international operators are great benchmarks and case studies to help our strategies internally as well. But if you think about it, I think, yeah, they've done lots of interesting things, from telehealth, telecare to connected hospitals, and some similar to some of the trials and work we've done as well. So I think there's definitely lots of learnings from that. And I think, as you said, it's starting with the connectivity, which is where we have a core right to play, and then working up that value chain with the partnerships to start with is probably key for me.
And I know that you were doing a couple of POCs within the healthcare space as well. So I guess circle back some of the applications that you've been looking at, and does it resonate when Jayne was talking through some of the apps that she's working on, or are you looking at a slightly different space?
No, I think it's really great to hear that the exact examples Jayne mentioned are some that we've trialed a couple of years over the last couple of years. of the connected ambulance, we've been doing some trials in a Millbrook testing ground where we have a 5G network, so we can start to show how 5G connected vehicles and a smart ambulance could look like and provide that remote consultation, to then using 5G tethered drones. And we've done a partnership with PhotoKite, so providing 5G access to emergency responders in rural areas and providing that connectivity to help provide information in a situation where they can then help communicate and analyze things. I'd say probably our most recent example is more of a private network, which is, as so Joann mentioned, where we've been working with the NHS and the South London and Maudsley Foundation Trust. And just around over the summer, we switched on our first 5G connected hospital, so building a very dedicated 5G mobile network here in London to provide that connectivity to demonstrate really the benefits of 5G for the NHS. And I can tell you a bit more about that if you're interested. So really, it's a high-speed, self-contained private network. So what we're offering is really the reliability, the efficiency, the accuracy, that connectivity. And then that really helps unlock a number of different use cases. So we've talked about and trialed a number of different things. One of those is actually connecting up some of their fridges to keep medicines at the right temperature, understand where some of those assets are. The most important use case, I'd say, is actually helping connect their handheld devices with 5G for this live patient e-observation app. So getting digital patient records to clinicians instantly so they can update their information and treatments, without relying maybe on Wi-Fi. And then connecting all the other equipments. We've used augmented reality and computer vision as technologies and provided solutions to help engineers augment information while they're providing IT support or computer vision for footfall analysis and analysis around the wards as well.
Perfect. And João, I don't know, does this resonate with you in terms of some of the applications? And I don't know where kind of as Altice Digital, your kind of focus within the healthcare segment would be.
Yeah, for a couple of time we are been testing different kind of applications that we can use and make benefit of 5G or over 4G and the legacy solutions like even Wi-Fi, and of course there are a couple of those scenarios and use cases where really 5G makes a big difference. We have been testing different scenarios and POCs ranging from connected ambulances, HD virtual consultations, remote patient monitoring, AR, VR assistant for the blind, or even for remote surgery. And if we look at all of those cases, as I mentioned before, not all of them take fully benefit of 5G, but the ones which really require low latency, very high reliability and security, and high bandwidth are the ones that we are targeting for 5G, and those are where 5G really makes the difference. Of course, when we speak about 5G, there are different options. And once again, we can work some of those use cases using the standard telco public 5G, but for some of the others, 5G private networks are key. And as I mentioned before, we are doing some POCs using private 5G solutions, even for the more advanced use cases like this remote surgery use cases or augmented reality use cases where you assist someone using AR, VR. So.
No, that makes sense. And I mentioned obviously at the beginning, I'm kind of leading on healthcare within STL, but also leading on private networks. So really interested between, all the POCs that you're both driving there and trying to push that forward. One of the things I'm really interested in and understanding is building the business case around a private network within healthcare may be quite complex because it's not a traditionally IT savvy industry. There's not a lot of space within the hospital premise to put on more IT infrastructure, not the skills or the budget to then handle an on-premise resource. So with some of the POCs and pilots that you're doing and the applications and the value that you're creating through those applications, what are some of those business case conversations that you've been having in terms of how to manage having that infrastructure actually, on site for the healthcare provider?
Yeah, still on me, Darius?
Yeah, let's stick with you.
This is a complex question, and you are fully right. Usually, the healthcare sector is not so techy enabled today, and when you speak about connectivity to start and then edge computing, that sometimes is needed to support some of the more critical applications and so on. There is, of course, a long path to go, and I think the way to move is through partnerships with some of the players which are already present on the technical aspects of the health sector, and bringing the extra capabilities we need to provide those advanced services in terms of advanced on top of advanced connectivity. For instance, the private 5G networks are a good example where you can really deliver a RAN network with very controlled radio quality inside a health institution. We can provide the edge computing needed for running the critical applications, and then we can do partnerships with the guys that understand the business, have the applications to run those applications on top of this, I would say, high reliable technology that we could provide. As on the previous panel, this is a place where I think we cannot try to do everything alone. We need to find the best suite to build up an ecosystem of players that could really bring the advances of these new technologies to the end user and to take care of people, because at the end this is all what matters.
Mm-hmm. No, that makes a lot of sense, and kind of introducing one of the challenges around IT skills and knowledge and expertise within the healthcare industry, but there's also the challenge around kind of that knowledge and expertise within the patient base and within the practitioner base. And I know, Jayne, that was one of the challenges that you'd identified kind of in the earlier discussions that we had, in saying, that education becomes extremely important in terms of adoption of these connected technologies. So again, wondered if you could talk a little bit about your experience and your kind of perception of that education phase.
Yeah, so it is interesting because, like I say, with my move over to WM5G, what I find is my head explodes on a daily basis very often with some of the technology solutions that are out there that are incredible. And I think sort of adding on to Jo's point as well, is that I think it's very much a collaborative space now, because I think a number of things, the collaboration actually will provide better solutions for across health and care. But yeah, you're absolutely right. As I think some of what we found is that the best implementations and adoptions of things that are digital solutions to support both clinicians and members of the public are where the engagement with them has been very early on, so that they understand what they're being asked to do and how to use the technology. Because I think sometimes we make the mistake that actually it's just the members of the public that we perhaps need to educate on how to use some of the tools that we're asking them to do for self-monitoring, etc. But actually quite a lot of staff across NHS and local authorities are in a similar position. You know, some of the ages of the workforce, etc., means that they're sort of in probably a little bit like myself, is actually they'll be fine, but actually they do need a little bit of education to understand what the benefit is. And I think where lots of these have worked well is where they've been clinically led. So actually you've got clinical teams who actually feel that there's benefit to be had by both staff and members of the public and carers and people that support members of the public. They can actually identify that there are benefits there to be had. So actually they're keen to adopt these new solutions, and they've had the information that they need to be able to use them appropriately. I think quite a lot of what we've seen as well is with some of the solutions that we've got, probably they're not fully utilised either, because actually people only know a tiny element of it. So definitely that's part of the work that we're doing, is some of the things with introducing learning networks so that staff across health and care can share some of the good experiences that they've had, actually, so they're not starting with blank pages, but also identify some of the things that work really well as some of the things that actually don't work well. So I think there are lots of pockets where things like virtual wards and assisted living technology has worked incredibly well, is where people really understand it and get it and know how to use it appropriately.
No, that makes a lot of sense. And I think it ties in quite nicely with a point that you made, Joann, around consent as well, and that education being vital in getting the consent to actually use these connected technologies and be able to access some, you know, obviously confidential and anonymized, but patient data. And again, wondered if you could talk about some of the research that you've done there.
Yeah, consent and ecosystems are very fundamentally tied. I mean, when you think about an ecosystem designed by its very nature, it is very open, and it places the citizen and the decision makers at the heart of that system. Traditionally, health systems have all been designed to be closed, to be functionally correct, but not open by their very nature. So when you overlay an ecosystem design to an existing health environment, then it requires this need to redesign the systems from being closed to open, placing the citizen at the center, the patient at the center of the system. And by virtue, it becomes a system that needs to have consent at the center of it. So rather than focusing fundamentally on interconnecting two pieces or three pieces of the architecture, you're really looking at being able to open and onboard different systems based on the needs of that community, and then also driven by consent, and be able to propagate that consent across that system. So it's complicated, but it's actually an awful lot easier in reality than actually hard integration and then managing in theory, or how do we choose to share what information from A to B and B to C. It's actually much easier to overlay with an ecosystem design and be driven by the legal requirement of consent by the citizen. So I find it fascinating that we're still not there. I think the culture of really being open systems and being willing to onboard other systems and data to enable the citizen to be at the heart of the system. I don't think we're quite there yet.
No, that makes sense. And is there an entity, a regulator or a telco or other party that should almost be taking responsibility or accountability, I suppose, for driving that consent and putting the patient right at the center of the ecosystem? Or do you think, again, because ecosystem generally means more decentralized, that accountability has to fall across partners?
Yeah, I think it's probably still part of that barrier, that there isn't a general consensus on that. But without such a consensus, the onus really lies with the respective governments. And that's usually how it's being handled. There is a health data initiative in Europe And that's where the assumption is lying, is that it would be regionally owned as opposed to any private entity or anything like that. However, you would expect the private entities to be then supporting the development of those systems and managing, playing an important role in that partnership.
And is coming up against some of these regulatory barriers, Sandeep, part of what you've had to kind of navigate with some of the POCs or early kind of strategies that you're formulating?
Yeah, I think definitely it's something that we think about from our tests and trials. So when we think about the use cases and the applications, defining those, trialing those in environments where we can demonstrate what the solution and the benefits are, and then working with organizations like the NHS and others to help demonstrate the benefits and the value, and then address regulational challenges that there might be in adoption or issues around that as well, for sure.
One of the final challenges that I know we brought up before was this idea of accessibility as well. So not just of educating patients around the value or the benefits of adopting a tech, but actually, how do you make sure that there's digital inclusion, I suppose, and that people can actually access this tech across a spectrum of the demographic of the UK or globally, really. And again, I don't know if that's something that you've had to factor into some of the early works that you're doing, or again, Jayne, if that's something that you've run into in the West Midlands 5G programs.
Yeah, probably let Jayne comment. More of my applications use case a lot been B2B, helping clinicians and users, and of course then there isn't a digital inclusion or accessibility element, but I imagine the panel may have a view from a patient perspective.
Yeah, so adding on to what Sandeep said, I think from the technical point of view, my colleagues on the panel are much more expert in being able to talk about that. But I think these are some of the challenges definitely that we're finding at the moment, in that, with the way that the health and care systems are now reforming into integrated care systems, integrated care boards, quite a lot of what they've all been busy doing is developing their new digital strategies for the next X many years. But interestingly, an element of that is that they haven't necessarily thought about the connectivity element at all. And some of the challenges I think we're seeing is that, particularly with the state of the economy, etc., at the moment, is that it's people's ability to afford connectivity. If what we're actually suggesting is some of the solutions actually needs them to have the connectivity there. So I know that local authorities are putting lots of things in place about, like warm spaces and some of the elements around connectivity to try and support their local populations. But it absolutely is a challenge, particularly in some of the more rural areas, actually. So what I would say is I don't think there's a simple answer at the moment, but I know that it's something that people are identifying and are working on to try and remedy.
That makes a lot of sense. And I guess coming back around, João, to one of the things that you mentioned when talking about some of the solutions you're building around, working with partners to kind of help you start to deliver. I wonder, is that notion of accessibility something that you discuss with those partners that you're trying to work with, and how do you build a solution that will, enable a whole population? Or at the moment, is it a little early stage for those kind of conversations, and it's more about, what can physically be enabled by things like 5G and private networks?
Yeah, I think in relation to partners and to solution providers and to entrants, you see every day tons of new entrants on this field trying to bring different applications, innovations to the field. Lots of startups coming every day, but what we can't see today are really global and integrated solutions using, for instance, and going back to Joann, that was referring about the data and the common data. We don't see a lot solutions try to work together over a common medical data layer involving all the actors, especially the established healthcare providers. And this, in my perspective, is really the biggest challenge, to build a real ecosystem with all the providers. Of course, from the telco perspective, and going to the fundamentals, we of course are good in delivering the connectivity, and even on the connectivity side, there are different regulatory scenarios where you can use 5G, and once again we can use our public networks with slicing and so on to provide a very good connectivity services for the healthcare sector. But of course, we can also work on the full private solutions. This is our main skill. Of course, we have expertise also on the edge computing, the platform handling and management. But of course, in order to be end-to-end, we need really to have an ecosystem of partners with complementary solutions that could help the different application domains. And as I mentioned initially, hopefully working on a standard data and common data framework. And this is, in my perspective, the biggest challenge today.
Mm-hmm. No, that makes a lot of sense. And we've used the term ecosystem quite a few times, I guess, throughout the discussion. And I guess fundamental to be able to work in a true ecosystem model is having that standardization. But then, as you mentioned, Joann, you do run into some difficulties around, well, where's the control, and how do we make sure it's patient centric? But I wondered if actually we could take a step back and maybe for some of the audience on the call define what do we really mean by working in an ecosystem, because I think ecosystem models are a relatively new concept to quite a few people, and especially in the context of healthcare. So actually, Joann, I might come back to you because I think it was you who mentioned it first. What do we really mean about working in an ecosystem model?
I guess if you were to kind of put it simply, is that you create a ubiquitous experience for the patient. In the context of healthcare, you're creating a ubiquitous experience for the patient across many different silos of systems. And they wouldn't be aware then of the notion that you were crossing many different systems. And it feels very centralized around them, their experience. If it's been designed with that ecosystem mindset in the back, in the architecture of the system, there's partnership arrangements, there's onboarding, there's systems for management of the data and the citizen through that whole series of different platforms and health functional areas. So the experience would be where it would be realized by the citizen would be in their experience.
That makes sense. And when we think about kind of ecosystems, what role within healthcare, what role then do we see a player like a hyperscaler playing? Because the telcos, they're quite local, quite regional. There are established players that maybe are delivering services to the NHS already. The cloud players, these big global entities that are making strides into B2B and even possibly into private networks as well. What role do we see them playing? And I don't know, Sandeep, you're kind of nodding. I don't know if you've got some thoughts on this.
Sure, yeah. So yeah, when I think about ecosystems, thinking about everyone coming together to really play to their collective strengths. So of course, as you said, we have some of those really great relationships and services we provide to the NHS, but then obviously the hyperscalers have that investment in R&D, computing and the legacy they've developed there as well. So coming together, providing that technology, that infrastructure to run and support applications and working in collaboration, I think is really important, because you can then create some really compelling solutions that can scale, and that's really key.
Yeah.
And Joann, on your side?
Yeah, scaling is key. That's very, very, very good point there by Sandeep. And that is the difference between traditional architecture and ecosystem design architecture, is its scale is built into the design.
Mm-hmm. No, that makes sense. And by the way, to the kind of audience, if you do have any questions for the panel as well, we did want to allocate some time at the end to answer any of your questions. So do drop them in the chat. We obviously have more that we'll run through, but if you do have any questions, obviously put them in and we can try and get to them. So we've obviously spoken a bit about the role of the hyperscaler and them being a key ecosystem player and being able to build that scale. The role of the telecoms operator then, because obviously they're the ones that are possibly supplying the 5G or the private network. And Joann, as you mentioned at the beginning, possibly looking to move further up that value chain, that stack. How do you think they're being received within the healthcare space? Do you think they have an advantage to play here and to really take on that new role? And again, maybe Sandeep, I'll come to you first.
Yes, I think a lot of the experience is building on the sort of our legacy and our relationships as well. So, even through the pandemic, connecting up 16,000 vaccine centers with 4G and IoT gives you then the opportunity to engage on helping, the NHS on their digital transformation, as you can prove you have the scale, the infrastructure and the capability. I think that's really important. But I think it does come back to what we've just talked about, those partnerships, those ecosystems. So even with the work we've done with the South London and Maudsley Trust, a number of partners were vital to bring those end-to-end solutions together to then unlock that transformation and demonstrate the benefits, right? So I think it'd be naive to think we could do it on our own. And that's where it's important to start to form those partnerships. Often they could be driven by the customer, who'll have some preferences and organizations they want to work with. And it's really being open to that and not being in a closed environment trying to think we can and dominate everything. So.
And Jayne, it would be really interesting to get your perspective on this, both from your experience within the NHS, but also from West Midlands 5G standpoint. Who are the partners that you both enjoy working with, but also, what are some of the challenges you have working in a more ecosystem kind of model?
So I think what has been interesting for me from sort of moving out of the NHS environment into a more commercial environment is that I think one of the things that it's shown me is how little I knew about what was available out there, because I think what happens is when you're working in an NHS or local authority organisation, you only know what you know, and actually quite honestly, you don't have the headspace all the time to go away and do some of that working out to work out for you what's the best solution. And I think building on some of the points of my fellow panel members earlier is that I think the skills and knowledge within the NHS, it's a completely different level to what's required to deliver some of what is required now. So I think one of the things that working for WM5G has shown me is that I think we're in a good position that we're sort of product and solution agnostic. So actually we are able to have conversations with lots of different people. And I think, again, as my fellow panelist says, I think this is such a huge challenge to tackle, that I think the only way that we're going to do that is collaborating. And I think one of the good things that I have seen is the ability that a number of different companies now are prepared to collaborate and work together to deliver some of the solutions that are required. So a bit on like Sandeep's point is it's not particularly about dominating the market. It's about what have people currently got, and what would be the best solution or combination of solutions to put together to deliver what they need, because actually they're all sort of structured very differently depending on what they've already got in place. So I think this is an amazing opportunity now, and I think there's been a real sea change. I think probably COVID in some respects did us that favor, is in that we saw lots of acceleration in this area that wouldn't have taken place at the speed that it had to do to deliver what was required. So I think this is a great space and opportunity now for lots of collaboration to take place.
Yeah, maybe one tangible example I can add to that, and it's really good collaboration we've had with the West Midlands 5G. So one of the consortiums over the last couple of years working with O2, Deloitte, Wire UK and the Digital Catapult, we came together as a consortium, so a partnership ecosystem, really working with West Midlands 5G to deliver, an acceleration program for driving 5G across various industries. And there's a really great healthcare campaign program and accelerator, which then really start to drive that ecosystem, finding those startups, those scale-ups, bringing together the business problems, and those types of environments that West Midlands 5G has helped us with, as an example, can really then unlock those future use cases as well. So I think that's really good example to bring out.
And a pertinent question here from one of the kind of participants, Nick, saying, we've got some really great use cases here that we're discussing, and when things are going well, makes a lot of sense and there's a lot of value that can be created. But what happens if something goes wrong? Especially if we think again in the context of an ecosystem, who's accountable? Who's responsible for making sure that those things don't go wrong? But when something is kind of not going the way that use case requires, who's responsible for making sure that it's spun up correctly and it's mission critical? Because of course these are people's lives that are at stake in a lot of cases, and people's confidential data. And again, I guess specifically within the context of healthcare, how do you make sure people have that human level of interaction, and they don't just get an app telling them that someone's busy and they can't connect and they can't get through? They actually have that human sense of interaction. I don't know, Joann, if that's something that you've looked into.
Yeah, there's a lot of questions in there. Yeah. With regards to the original question on responsibility, that's part of what needs to be designed into the ecosystem. So largely at the end of the day, the ultimate responsibility will lie with the healthcare provider and all the other technology providers or suppliers into that system. So that I don't see that shifting fundamentally in the short term. However, you know, the potential for new types of models will be laid in the next couple of years, so it could change in the longer run. You do see, however, health insurance companies playing a much bigger role in provision of non-acute care and wellness and things like that. So you may see a shift from that side as well. But yes, it needs to be designed in, not just the sunny day scenarios, but also the difficult situations, because you are dealing with critical services and emergency type services. So it simply has to be managed. That's the first part of the question. I'm not clear really on the second part.
Well, maybe I'll try and rephrase. So maybe I'll move to you, Jayne, actually, for the second half. How do you balance the drive towards automation and digital and, you know, these more I guess efficient technology solutions with the kind of natural desire within healthcare to have a human interaction? You know, how do you balance those two factors?
Yeah, so I think it probably goes back to one of the earlier points I made, is that it's really key to have clinical engagement in this, because actually if actually the clinicians that deal with these, you know, vulnerable people on a day-to-day basis are happy with the solution that's put in place, then actually they're happy to use those solutions to actually deliver that product. So I think some of it is and actually it was interesting, and I think it was in Leo's talk earlier, which is some of the way that products need to be designed now is what is the problem you're trying to solve, and how can we work with you to develop something to deliver that, rather than we've got this fantastic product that we'd like you to have. So some of it is actually that co-creation and co-design with people to understand what it is the problem that you're trying to solve, what is the condition with the member of public, so what is the illness or condition that you're trying to support, and actually how do clinicians do that. So some of it is that yeah, I think you're absolutely right, and I think in some cases there will be cases where a digital solution isn't necessarily the right one. So I think some of that is it's being really key and having the real good challenge from clinicians about what is the value in this. Is it safe? Is it going to deliver the quality care that we want to do? Is it supportive to the patient? So I think that's where the balance comes in, is that having really innovative and creative solutions, but actually having the co-design from clinicians to deliver that challenge about, is this actually the right thing to be doing for this person?
Perfect. And I think that's a great place to end. And with that, I'll hand back over to Annie to introduce the next session. But thanks a lot to the panel. I think this is a really interesting one and covered quite a lot of useful bases for anyone thinking about kind of delivering technology into the healthcare space, or looking at understanding kind of the role of 5G there.
I thought it was a great discussion, really interesting, and it kind of serves to show how much scope there is, which is fantastic, but also that it's complicated.
Definitely.
as all things in life tend to be. But anyway, thank you to all of you. That was terrific.